Hi, welcome to Wellness Medicine, and I am Dr. Jelunder Clark, and here our mission statement is we are paving a pathway in medicine to build bridges to optimal health and wellness. Well, it's been a minute, but let me tell you, we've got great information for you today, and I have a fantastic guest that I'm going to love for you to meet. So, as we are going to stay tuned for just some fantastic information that's not only going to be able to help you achieve your optimal goals, but also be able to help you to be able to help others achieve optimal goals as well. So you just stay tuned for what we have coming up next. We're going to be talking about prediabetes and a whole lot of other great things that are going to get you to your best. So just stay tuned here at Wellness Medicine. And remember, if you always want to know more about what it is that we do and how we do it, please visit us at wellmed.us, and that is WELLmed.us. So just stay tuned and we will be back shortly.
I'm going to start.
Well, welcome back here at Wellness Medicine. Again, where if you want to find more information about us, visit us at wellmed.us, WELLmed.us. So today, our wonderful guest is Ms. Erin Jerger, and she is a certified diabetic educator as well as a registered dietitian. And we are so excited to have her here today because she actually represents a great company that's called HDL. And believe it or not, HDL in this case does not mean high density lipoproteins, which is what you read on your reports, and especially when you come to our clinic. It actually stands for Health Diagnostic Laboratories, and that's exactly what they do. They do diagnostic testing in their laboratories to help you obtain the optimal health. So she's got wonderful information she's going to discuss with us today. So I am going to quickly turn it over to her hands, and now we want to welcome Ms. Erin Jerger.
Great, thank you so much. I'm thrilled to be here, especially to talk about something so important as our health.
Yeah. And the one thing that I really do love about Health Diagnostic Laboratories is, to me, they're one of the forefronters in being able to bring forth the information about prediabetes.
Absolutely.
So talk to me a little bit about what is prediabetes.
Well, prediabetes is that diagnosis before diabetes. So your blood sugar isn't quite high enough to be yet diagnosed, but we know there's a lot of complications still that can be happening. And you can be pre-diabetic for a number of years before you're even diagnosed with diabetes. So it's important to catch it early.
Right, because it's my understanding what can happen is when you are diagnosed with prediabetes, it puts you at risk for developing diabetes within about 10 years.
Exactly right.
So the sooner we're able to get on top of this and really help people start to make a lifestyle change, hey, that's where we're making the biggest impact.
That's absolutely correct. And I've seen great things with patients when they take their own health into their own hands, and when they get diagnosed with something like that, it really turns them around.
Oh, well, listen, you've got just some wonderful information you want to share to us. So I'm going to dedicate a lot of today's time in letting you be able to go a little more in depth, about some of the things that you do and some of the tests, and give a little more explanation about the prediabetes and how all this really works together. So please go ahead.
Okay, thanks, Dr. Clark. Excellent. Well, again, I'm happy to be here. I want to tell you a little bit about Health Diagnostic Laboratory. Our mission is to beat cardiovascular disease and diabetes one patient at a time. So it's a pretty strong mission, but we are one of those labs that is willing to do it, and we're making some great headway. The lab was really created because 50% of people that have heart attacks have normal cholesterol levels. And that's kind of scary. If you feel like your LDL and your HDL and your triglycerides look excellent, that isn't giving the entire picture. So today I want to show you a couple of things. Here I've got a couple of slides, but I do want to show you what our lab looks like. So this is actually a sample. It's a case study. It's not a real patient, but this is actually what our laboratory testing looks like. It's laid out very nicely in your green, yellow, and red, so you can actually understand that red is where you're at risk, yellow is intermediate risk, and green is normal. So this speaks really well to patients as well as providers. Providers and physicians can get through this testing easily because it's laid out so well. So I do want to share a couple of things. So HDL was founded about 5 years ago, in about 2010. So what we're doing since then is really making a mark in the industry and letting patients and providers know that they can take their health in their hands. So let's look through a couple of items that I wanted to share with you today. As I mentioned earlier, 50% of people go undiagnosed with traditional risk assessment. So we as patients need to be asking our physicians, what can I do to reduce my risk for heart disease and diabetes? And you'll see here, even on this posting here, these people have developed diabetes or had strokes when their numbers look absolutely normal. So what can we do to uncover some of that? So let's look at someone that we may know from the media that had some issues. This is Tim Russert. He actually had a very normal cholesterol looking test. He had, total cholesterol was 159. That's completely normal. His HDL was 32, his LDL was 67. He actually even had a normal stress test within the last 2 months before he died of a heart attack. That is not something that we want to experience. We don't want our family members to experience it. We ourselves don't want to experience it. Yet we keep hearing these things, how, so-and-so is 55, she was in great shape, or she was, always eating healthy, she was thin, she looked like she would never have a heart attack, and then these things happen. And we really want to prevent that, and that is the mission of our company. Now, diabetes and cardiovascular disease go hand in hand. When you are diagnosed with either insulin resistance, prediabetes, diabetes, those things lead to cardiovascular disease. So they really are one and the same. People with diabetes typically have more issues and complications with their heart because of the diabetes. I'm very passionate about this. I feel like diabetes can be easily prevented, and really looking at lifestyle, nutrition, exercise, stress management. Of course, if you need to take medication, your doctor can put you on the proper medication, but it really is treatable, and it's something that all of us should be looking at. So I've heard things about a diabetic diet. Everyone should be on a, quote, diabetic diet. And what is that? That's actually controlling your carbohydrate. And a lot of people, are very interested and have been hearing more and more about this. You also may have heard the term insulin resistance. Well, insulin resistance is an interesting process that happens in your body. Insulin is a hormone that helps you break down your blood glucose. And when you have too much of it in your system, it starts overloading and really causing some damage to your cells. So just to give a quick, kind of recap on insulin resistance, when you eat something with sugar or carbohydrate, your blood sugar goes up. Your insulin is produced by the pancreas to make that blood glucose go down. Well, that's a normal kind of glucose measurement. So that's what's happening in people that have normal glycemia. Well, if someone that doesn't, and they're having insulin resistance, they're eating something with carbs, their blood sugar goes up, their pancreas secretes the insulin to bring it down, but it's not going down enough, so it secretes more insulin. It's still not going down enough, so it secretes more insulin. And that's where you get this overabundance of insulin in the body, which starts really putting a toll on your body. So at Health Diagnostic Laboratory, we actually don't just look at blood glucose and hemoglobin A1C. We're measuring insulin levels so that we can actually diagnose patients earlier, or help the providers diagnose patients earlier and have them work on their lifestyle before they actually become diabetic. So really powerful things. Another part of Health Diagnostic Laboratory is we have a fantastic diabetes and cardiovascular disease management program. And anyone that has our testing has access to registered dietitians, diabetes educators, exercise physiologists, nurses, nutritionists, people that are very well trained in not only this testing, but how we can help you become healthier through nutrition, exercise, stress management, and medication compliance. So all of those things really play well together. So that is something that Health Diagnostic Laboratory believes in, because if we just give you these test results and we don't tell you how to fix it, what are we doing? You know, then that's not fair to you, because you need to be able to know what to do to make those changes. And there's so much information out there that we want you to have the best, most accurate information to help treat these. And what's interesting is you can use traditional medicine, and many doctors do. You can also implement some supplementation. So you need, as a patient, to approach your doctor and ask what your options are. And then as a physician, when your patients come to you, you'll be armed with this type of testing that can help your patient to become healthier. So let me show you a little bit, since we're talking about insulin resistance and diabetes. The normal testing, so normal testing for diabetes, or when you get diabetes, is up here when your blood sugar is over 125. Well, if you look here, this line right here is documenting fasting insulin. So you can see that your insulin has already started to increase, but your blood sugar looks completely normal. So this is where it can be frustrating, because you said all these years nobody's told me I'm, had any blood sugar issues. Well, you haven't. You're having insulin issues, which are then leading to your blood sugar issues. So in this time frame is where we would really like for patients and doctors to be looking, because at this time your insulin's elevating, your lipoprotein abnormalities are increasing, and that has to do with your cholesterol and your particles and inflammation. That's already showing to be high. By the time you get diagnosed with diabetes, you're already getting beta cell dysfunction, which is from the pancreas. You're already seeing your insulin depleting, which you don't want to have, zero insulin. You need insulin to help control your blood sugar. And at that point is when people have to start being on medications. But over here, this is very manageable. We can get you with, the right exercise plan, the right nutrition plan, and you can really just stay at a normal glucose until, forever. So that's something that, needs to be empowered by you and as a patient, but you really can keep that blood sugar normal. So that's a little bit about the progression of untreated insulin resistance. And that is a term that you'll hear more lately in the media. And what's interesting about these tests, if you look at this panel, this patient right here at the top, they're all green. So they look great. You would normally say, you look good, your cholesterol's good, your heart's good. But when you look at some of these other lipoproteins, inflammation markers, genetic markers, those are showing to be abnormal. We even have a panel that's looking at a breakdown of your blood sugar. So same thing, this person looks pretty normal up here. They're all green, their blood sugar looks green, their A1C is green, but look at all these red markers. And remember what we said, it's kind of like a stoplight. Red is stop, you're at risk. Yellow is wait, hold on, you're at intermediate risk. And green is you're good to go. So when you see something like this and you think, oh, I'm at tip-top shape, I'm doing great, let's think again, because we do have some things to work on. I've heard a lot of patients say they're scared to have this testing because they don't want to know, but you have to know this kind of stuff. I mean, this is important, although it is, a little bit intimidating. if you don't know it, you could be walking around with issues that could be easily preventable. So I know it can be scary, especially if you've had a family history of heart disease or diabetes. Sometimes people want to know everything, some people don't want to know anything. But I can tell you is that knowledge is power, and by having this in front of you, it really arms you to fight for your own health and well-being. And not just for how you look on paper, but how you feel. I mean, you will feel better when you get these markers at a normal state, because it all has to do with our energy and how our body is functioning. Okay, now HDL takes research very seriously. We actually put together some of our own research in-house, and we work with other programs as well. But one interesting clinical or trial that we did was we looked at over 7,000 patients who had received at least 2 health diagnostic laboratory tests over a 1-year period. We compared that to a control group that did not receive HDL testing and did not take part in our services, but just had traditional lipid panels. So this was the traditional comparison. Up here is the people that had our advanced testing. We got some amazing outcomes. Heart attacks were reduced by 41%. So people that actually utilized our testing, and that's because they've uncovered things that their physician can work on to help them become better. Ischemic strokes trended lower by 17%, and diabetes complications fell by 15%. These are some powerful numbers. And as a dietitian and a diabetes educator, and as a patient myself who has a family history, these are the kind of numbers that I want to see, because I want those to work for me. So also with this, inpatient admissions to hospitals fell by 21%, and ER visits were 6% less frequent. So again, not only are we helping you personally, but we're helping healthcare costs, we're helping a lot of other areas as well. The cost-saving outcomes, ambulatory costs were about 13% less, ER costs were 19% lower, inpatient costs 17% lower. So really, we've got a good product that's helping save money, it's helping your health, it's helping reduce risk and reduce heart attacks and diabetes and stroke, and it is available for you. Another thing I really want to bring to your attention is our disease management program. We have a team of what we call clinical health consultants, and they are either registered dietitians, diabetes educators, exercise physiologists, nurses, nutritionists, all equipped to go over these labs with you and to walk through your nutrition plan, exercise plan, stress management tips, and then explain to you what your medications are and why you're taking them and keep you compliant with those. We also offer support to the practices, which this is very beneficial because we know that doctors' offices can be very busy. They may not have all of the time they need to really dive deep with you on these services. So we like to do that, but then we communicate back to the doctor with what we've talked about in our conversation, and we actually give a chart note to the practice so that the doctor can see what we've been working on. I'm a big fan of the more people that are in your support group, the better. So if you're hearing one thing, if you're hearing it from your doctor, if you're hearing it from your clinical health consultant, if you have a friend that's helping you, if you have a family member that knows that you're on board for this healthier lifestyle, the more people you have surrounding you, the better. And we really feel that this part can be beneficial. And the doctors are loving it as well. They get that extra support that they may not have available in their practice. Now, there's a couple of different ways that you can get this education. You can actually call our 800 number, which we have listed on our test results, so every patient has access. You go ahead and set up an appointment for a future date, and the initial consultation is about 45 minutes on the phone. Many people love this because then you don't have to be out and about trying to rush to an appointment. You can do it on your lunch break. You can do it in the evening at evening hours. We have early morning hours. So we really try to work with your schedule. In some cases, we do have one-on-one face-to-face consults. It just depends, where you are and what state you're in. We also have national webinars where you as a patient can log into these webinars every month and listen to the new latest and greatest topics in health. And in all of the things that you hear in the media, we like to bring it back to what's been researched, what can help you in improving your lifestyle and your test results. We have a patient website, a patient portal, we have a patient app, we have a physician app, and a physician portal as well, or a provider portal. So providers can also get continuing medical education. We really are trying to encompass the entire picture of health, and starting with the patient, but going to the provider, looking at your clinical health consultant. So we're really trying to complete those, that whole piece together.
Wow, Erin, that was just awesome. That was just great. Thank you so very much for all that wonderful information. So I promise you we have a lot of great information coming. But listen, Erin, I want to ask you something else. Now we're talking about, all that HDL does. And one of the questions I had, because I really do appreciate my health coach. That service is just really so awesome. I think you do this thing, what they call motivational interviewing. Well, there's not one patient I sent them to that hasn't lost weight. And that is awesome. But listen, here's a question I want to ask you.
Okay.
So what about those people who are still trying to lose weight and are really kind of listening in, but still aren't getting there? So what would be some of your tips for those who are really, really having a hard time losing, and especially someone who's gained weight and gained recently?
Absolutely. In all my years of experience with helping people try to improve their numbers but also lose weight, I've really come to the conclusion that carbohydrate is what we really need to be watching.
Okay.
A few years back when fat became the culprit, and everything became low fat, well, we had to supplement with something, so people went with carbohydrates. Exactly. And that's where we've really seen a trend in insulin resistance. So we're really trying to control carbohydrate intake and really throughout the day. So what we're kind of recommending right now is about 25 grams to 30 grams per meal, or considered every 4 hours. And then that keeps the body very, balanced, and you're not getting any spikes or any dips in your blood glucose, blood sugar. And I found that to be very successful.
Okay, fantastic. That sounds really good. This may be such a little about this. What about adiponectin and leptin levels?
Absolutely. Leptin, when you have leptin resistance, your body is actually craving more. So that's a hard thing. If your body is physically craving more, we've got to stop that.
Yes.
So we do measure leptin through our lab. And we actually can tell if the patient is dealing with this, and it's really eye-opening with the patient when you say, let me guess, are you constantly hungry? Are you not satisfied right after you eat? I'm like, absolutely, and then you say, well, I can see that here and we can help.
Oh, good enough. Now, three got a little bit of a curveball, because I know you're not necessarily familiar with leptin and adiponectin, but I did that intentionally, just to kind of throw that out there, because we are going to come back and really expound on that. It won't be this section. It's going to be probably about a couple of sessions out, but definitely it's something that's very significant for those of y'all who really do find that you're trying very hard to lose weight and you can't. Got some great tips, like you said, what you told you, what to do with that. But also there really may be a reason why And stress is one of those big things that I think really kind of plays a part into that, you know.
Absolutely.
And I've had some really great things happen in my life recently, but they've also been very stressful.
Mm-hmm.
And just kind of being out and about and being with the kids and graduations and celebrations and things like that. But in case you didn't realize, the person was probably gaining a little bit. Okay, has been me. So, but you know, we're all in this journey together, so we keep it real, you know.
Right.
But the main thing is, can't let it get me down. Just got to figure out what's the game plan and get the game plan.
That's right.
And get back on it.
Absolutely.
So I'll keep you an update about how that's working for me.
I can't wait to hear. Absolutely.
Well, listen, you know, just thank you all so very much for attending, and Erin, I just want to thank you again for attending. It's good to have you back.
Oh, I would love to come back.
Okay, so once again, as I promised you, just a great segment. And here at Wellness Medicine, we are dedicated to paving the pathway in medicine to build bridges to optimal health and wellness. We're looking for people who are really, really sincere about wanting vibrant and optimal health, because we want to help you have a better you for better health, to have a better world. Once again, I'm Dr. Jelunder Clark here at Wellness Medicine, where we are paving the pathway in medicine to bridge to optimal health and wellness. And oh yes, by the way, just an update on DJ. DJ is down to 38 pounds, and we are so excited for him. He's got increased energy levels, sleeping, exercising, and just waiting for more lifestyle changes and more improvement, and definitely removing the negativity out of his life. So let's all take that hint and remove it out of ours as well. Thank you very much, and we really appreciate you. Look forward to seeing you next week. Remember, if you want to contact us, Wellness Medicine, look at wellmed.us, WELLMED.us. Have a great